What's going on, ladies and gentlemen? Welcome to this week's video at Shorehaven Veterinary Hospital's YouTube channel. Now, in today's video, we're going to be covering the importance of the FVRCP vaccination, which is a combo vaccination for felines that protects our cats against 3 deadly and contagious viruses. Now, the FVRCP vaccination is one of the core feline vaccinations, the other being the rabies vaccination, and we highly recommend all cats, even those that only stay indoors, to receive the FVRCP vaccine, and you'll see exactly why in the following slide, where we cover the 3 deadly and contagious diseases that this vaccination protects our cats against. All right, now the first disease that the FVRCP protects against is called feline viral rhinotracheitis. Now, the FVR actually refers to this disease in the vaccination, and it's a disease that's spread through sneezes, saliva, or eye secretions, but it can also be transferred through the environment, which is exactly why this virus is so widespread. Now, FVR, the feline viral rhinotracheitis virus, is a major cause of upper respiratory disease in cats and is the most common cause of conjunctivitis. The typical signs of FVR involve the nose, eyes, throat, and include sneezing, nasal congestion, conjunctivitis as mentioned before, excessive blinking, squinting, and discharge from the eyes and nose that range from clear and watery to thick and purulent, which means containing yellow or green pus. This is Mama, by the way. Say hi, Mama. Say hi. Hi, YouTube. Hi. Other non-specific signs of FVR may include fever, lethargy, anorexia, and enlarged lymph nodes. Now, the second virus that the FVRCP protects against is called feline Khaleesi virus. Now, the feline Khaleesi virus is highly contagious, and infected cats can actually spread the virus in saliva or secretions from their nose or eyes. Believe it or not, if an infected cat sneezes, the airborne viral particles of feline Khaleesi virus can be sprayed for several meters through the air and infect other cats. Feline Khaleesi virus typically causes the clinical signs of an upper respiratory infection involving the nose and throat, such as sneezing, nasal congestion, conjunctivitis, much like FVR, and discharge from the nose or the eyes. Now, keep in mind, there is also a much more severe strain of the Khaleesi virus, and it results in more debilitating symptoms, as well as infection of the internal organs, making it fatal more often than not. This just means that the vaccination, FVRCP, is even more necessary because it protects against the extremely dangerous, yet kind of rare strain of feline Khaleesi virus. Last but not least, the third virus that the FVRCP vaccine protects against is called Feline Pan leukopenia. Now, this virus can also be spread through sneezes, saliva, or eye secretions. However, FPV, which is feline pan leukopenia, is predominantly spread through contact with contaminated feces, which is very similar to canine parvovirus, okay? The virus can also live for up to a year in the environment and even on surfaces like water bowls, food bowls, clothing, litter boxes, cages, and etc. So it's pretty contagious. This means that your cat does not even have to come into contact with an infected cat to get feline pan leukopenia. So this is exactly why every single cat needs to be on the FVRCP vaccine. Come here, Mama. Hi. Hi, cutie. Feline pan leukopenia is highly contagious and has a high mortality rate. It causes anorexia, vomiting, fever, and severe diarrhea. The virus also attacks the bone marrow and lymph nodes, which leads to a very low white blood cell count and prevents the immune system from behaving normally. So, how often should cats receive the FVRCP vaccine? The FVRCP vaccine for cats is usually given to kittens that are around 6 to 8 weeks of age, and then boosted every 3 to 4 weeks until kittens are 16 to 20 weeks old. So it basically follows the same cycle as the canine distemper vaccination, the puppy series. The series of vaccines is necessary because it takes a number of booster shots for the cat's immune system to completely recognize all the components of the FVRCP vaccine. The FVRCP vaccine, being a combo vaccination, has several components that requires booster shots for the immune system to completely adjust to. After 16 weeks of age, the kitten should receive a final booster after 1 year. Then the vaccine only needs to be given every 3 years, which makes the schedule much simpler to follow. All right, so thank you so much for tuning into this week's video at Shorehaven Vet Hospital's official YouTube channel. Thank you for meeting our lovely hospital cat mama. Thank you for listening to how important the FVRCP vaccine is. If your cat has not gotten this vaccination yet, please give us a call.